Hello everyone, my name is Alex Bellarmino and today I'm going to be discussing cholera. On this page I have the statement of work which was researched, edited, and recorded by me. I'm going to start off with a brief history on cholera. In 1854, cholera struck the city of London. Over 600 people died in 2 weeks. Dr. John Snow is often credited for the discovery and ending the epidemic that occurred, and he did this by removing a contaminated handle from the Broad Street pump. So how could this have happened? Human fecal matter from infected people were mixed with the water supply that was in a shallow well that was 20 feet down the street. The bacteria would then multiply and people would ingest the contaminated water. People would die from hours to days. This is when Dr. John Snow realized that this is a waterborne disease. Cholera is a bacterial disease that causes severe diarrhea and dehydration. There are 2 strains of cholera. There is O1 and O139. The causative agent of cholera is the gram-negative bacterium Vibrio cholerae. It is a curved rod-shaped bacteria with a flagellum, as you can see in this photo right here. It is positive for oxidase and grows in alkaline media. It is also a facultative anaerobe that can undergo respiratory and fermentative metabolism. And finally, it is an enterotoxin bacterium, meaning it generates inside the body and affects the intestines. Cholera takes 12 hours to 5 days for a person to show symptoms, though some people don't show symptoms. Early stages of the disease include watery diarrhea, vomiting, dehydration, and lethargy. Some signs of dehydration include rapid heart rate, sunken eyes, dry mouth, fatigue, and low blood pressure. If severe dehydration is left untreated, it can lead to kidney failure, shock, and coma. In extreme cases, patients can lose liters of fluid from their body through watery diarrhea for several days, which can lead to death. These 2 photos are examples of what severe dehydration would look like. You can see the sunken eyes and the folding of the skin on his abdomen. Vibrio cholerae can be found in aquatic environments such as freshwater lakes and rivers. The 2 main reservoirs are human, which act as hosts, and water. The portal of entry is through the mouth, and the exit is by defecation. A person can get cholera by ingesting contaminated food and water. It can also pass through human to human by fecal-oral route transmission. It is mainly transmitted by water that is contaminated by fecal matter. It is important to note that Vibrio cholerae does remain present in stool for 7 to 14 days. It may not cause illness to some people who are exposed, but they can still pass the bacteria in their stool, which can contaminate food and water supplies. The virulence factor is the cholera toxin. The cholera toxin is encoded by a lysogenic bacteriophage and toxin coagulated pilus, which is an essential colonization factor and is also the receptor for cholera toxin. It acts by affecting the host's intestinal cells by stimulating secretion of large amounts of water and electrolytes into the intestines. The rapid loss of fluids and electrolytes can result to severe dehydration that would need to be treated promptly. In this photo, we have the cholera toxin being released by Vibrio cholerae in the intestinal epithelial cell. This leads the body to secrete an enormous amount of water and rapid loss of fluids and salts. Isolation and identification of Vibrio cholerae by culture of a stool specimen remains a gold standard for diagnosis of cholera. We also have the use of Kerry-Blair media and selective thiosulfate citrate bile salts agar, or TCBS, which you can see in this photo. Vibrio cholerae is growing on the agar plate. In areas with limited or no laboratory testing, crystal VC dipstick rapid test can be used. However, the sensitivity and specificity of this test is not optimal. Countries that do not have advanced water sanitation systems are at greater risk of contracting the illness. According to World Health Organization, since February 2023, cholera is endemic to at least 18 countries. Some examples are Yemen, India, Philippines, Somalia, Ethiopia, and Kenya. World Health Organization estimates that 1.3 to 4 million new cases of cholera occur each year, and there are 21,000 to 143,000 deaths each year. According to Guinness World Records, the longest enduring pandemic disease outbreak is the 7th cholera pandemic, which is the cholera strain 01. It originated in Indonesia and began to spread widely in 1961. As of 2020, this pandemic is still present and infects an estimated amount of 3 to 5 million people annually. Prevention of cholera consists of providing clean water and sanitation to populations. Good hygiene, which includes washing your hands with soap after using the toilet, before handling food, and before eating. Health education, oral or intravenous hydration. In this photo from CDC, here are 5 things to do to avoid getting sick with cholera. Number 1, drink and use safe water that is treated. Number 2, wash your hands often. Number 3, clean and disinfect your toilet or latrine, as well as wash your clothes away from drinking sources. And a continuation of that would be to cook well and wash fruit and vegetables thoroughly. Treatment with antibiotics for the severely ill patients and those who are immune compromised. Antibiotics such as doxycycline, tetracycline, ciprofloxacin, and azithromycin. There's also treatment with the use of oral vaccines. CDC recommends vaccination for people traveling or living in areas with active cholera. The names of the vaccines are Vaxchora, Dukoral, Sancol, Uvicol, and Uvicol Plus. Cholera is largely eliminated from industrialized countries by water and sewage treatment centuries ago, but it still remains a significant cause of illness in many African countries. The proportion of people who die from cholera remains higher in Africa than elsewhere, and this reflects from the lack of access to basic health care. In the Southeast Asia region, which includes Bangladesh and India, has the largest population at risk for cholera. Many countries face challenges with known risk factors such as poverty, lack of development, and high population density. Additionally, the region is susceptible to environmental factors such as flooding that can contaminate water sources and dislocate populations. So you might have heard of traveler's diarrhea. The best way to avoid it is to drink from filtered water bottles, wash your hands often, or take oral vaccine. If you don't think the water is safe, boil it. You can also use a filter with pores that are equal to or less than 0.3 microns in size. In the United States, chemical disinfectant such as chlorine is used to kill remaining parasites, bacteria, or viruses. This helps keep water safe as it travels to homes and businesses. And that wraps up my presentation. Here are my resources. Thank you, everybody.